Hey everyone, this is Daily Dose of Medicine. In this video, we'll talk about Varenicline. It's known as Chantix, primarily used as an aid for smoking cessation treatment. Works by binding to nicotinic receptors in the brain, reducing nicotine cravings and withdrawal symptoms. When we compare in nicotine replacement therapy, it works by providing a controlled dose of nicotine to reduce withdrawal symptoms. It's generally well tolerated, but may not be as effective as Varenicline. And Zyban, known as bupropion, is originally antidepressant. It helps reduce nicotine cravings. It's less effective when we compare it to Varenicline for long-term abstinence. So for Varenicline, it's recommended to start dosing 1 week before the planned quit date, or between days 8 and 35 of treatment. The dosing involves taking 0.5 milligram once daily for days 1 to 3, 0.5 twice daily for days 4 to 7, and then 1 milligram twice daily from days 8 to the end of treatment, which typically lasts 12 weeks. An additional 12 weeks may be considered for those who successfully quit smoking. The most common side effects we see are nausea occurring up to 30% of the patients. Other frequent adverse reactions like abnormal dreams, constipation, flatulence, and vomiting also seen. But we should also know that serious neuropsychiatric symptoms have been reported, including changes in mood, psychosis, hallucinations, paranoia, and suicidal ideation. These events can occur in patients with or without pre-existing psychiatric conditions and may be exacerbated by nicotine withdrawal. Thank you so much for watching. Don't forget to watch our other videos. I'll see you on the next one.